Hi there, this is Beth Ennis. I am reporting to you live from Sleepy Dog Veterinary in Arlington, Massachusetts, where I am the practice owner and veterinarian here. I am going to talk to you today about a topic that we get a lot of questions about here at Sleepy Dog, about inappropriate urination. So inappropriate urination is anything that is my first line was going to be to pee or not to pee. So urinating inappropriately could be in a dog, could be in a cat, can come to us in all sorts of different ways, and we're going to dissect it apart a little bit today to see if we can, if I can give you some information on things to talk to your veterinarian about if you're seeing any of these problems. So, to pee or not to pee? That is the question. First, we want to consider all of the medical reasons that could be contributing to this before we decide that it is not from a medical cause. For some reason, as humans, we like to jump to it being a behavioral problem first, but we really have to make sure that there is nothing underlying physically that's contributing to an animal either peeing in the wrong place, in a different way, at different times, or with different frequency. So the things that we are probably going to look to first to rule out would be some kind of underlying urinary issue, some kind of thirst issue that's ending up causing a difference in urination, a continence issue, so whether the animal is able to hold their pee appropriately or if it leaks out, or a myriad of other causes as well, but those are some of the things we'll start with. So some of the things that we as veterinarians and veterinary teams will ask you will be, when did this start? And so it's a good thing to start thinking about in advance. Also, when does it happen and how often does it happen? So it can make a difference to us in our line of thinking if we're seeing urination happening on the bed at night. It may be something different, like when the animal is awake, but they are, the animal is urinating, let's say it's a cat, maybe outside of the litter box. It could be something where it is happening all the time or every once in a while. All of these things are really important to us to know and for you to start keeping track of if this is something that you're seeing at home. The other thing we're going to ask you is, what does the urine look like? So does there seem to be any blood in it? Is there any change in color that's unusual? This is often easier for us to tell in the winter months when there's snow on the ground, but often you can tell some changes depending on where they're going. Is there, with a cat, you might notice a different size of clump in the litter box, or a different nature of the clump. Maybe it's stickier, maybe it is something is different about it, whether it is the same litter but a different kind of appearance. Those are things we want to know about. Have there been any other changes in that pet's body or behavior? Those are important things to note too. The other thing that will kind of help us to steer one direction or another is if the pet is young or if the pet is old, or somewhere in between. If this is something that we've seen in the past or if this is something new. Another question we'll ask you about is there any straining associated with this? So when they go outside to go pee or when they're in the litter box, do they take a little bit longer to urinate? Do they have, if they're a dog, or a cat for that matter, do they squat many times before going? These are all things that can make a difference and again, steer us down a particular path or another. Another question we may or may not ask you will be, do you observe it happening? So if you are never in the vicinity when this is happening, you may not know if they're straining, and that may be something that may tip us off as well about something going on with the animal. And then another question we'll sometimes ask is it happening after the pet is laying down, where they kind of get up and then there's a little bit of moisture where they were, or is it something that they are always consciously going to pee and they know that, whether they know it or not? All right. And so, how will we go from there? So, first, you're going to bring your pet in to your lovely veterinarian, and she or he is first going to start with a physical exam to make sure there's nothing that we see or feel in that animal to tell us something or another. It's going to make a difference how hydrated they are. It's going to make a difference what their belly feels like, their kidneys and their bladder. We may examine their, if they're a lady animal, we may examine their vulva area to see if there's anything abnormal there, or we may examine their penis and extrude their penis if they're a boy, for both cats and dogs. I think that the other thing that we may be looking for is their behavior in the exam room. Lots of things that we can pick up on a physical exam. If everything looks normal, or even sometimes if it doesn't, we may want to do some tests. And if there's inappropriate urination, chances are we're going to want to do some tests. Those tests may come in the form of, firstly, a urinalysis, so looking at a sample of the urine. We're going to be looking for things like infection, how well the pet is concentrating their urine. Is there any protein leaking into their urine that shouldn't be there? Are there any inflammatory cells that shouldn't be there? Are there any crystals that might make us think that the pH is steering the urine one direction or the other to precipitate some crystals, which can also create stones in the bladder or the kidneys? We may also want to do some blood work. We're going to be looking for things like infections, kidney issues, liver issues, maybe something that would indicate that there might be some diabetes involved, maybe some other hormonal issues having to do with the adrenal glands, or maybe having to do with the thyroid system. So all sorts of things that we can pick up with some simple blood work. When it comes to urinalysis, this can be really informative, and so this is something that if we're thinking that there might be an infection, we might see symptoms such as straining to urinate. We might see blood or mucus in the urine, more frequent urination. It may also cause some really subtle changes. So don't think that just because you're not seeing symptoms, there might not be a urinary tract infection at the root of this. So we may decide what kind of urine sample based on the symptoms that you are describing to us in our physical exam. So we can do it in 3 different ways. We can get what's called a free catch urine, which is when, if you've ever done it here at Sleepy Dog, we will be out front on the dirt part of the sidewalk area, chasing down, well, not chasing down, but kind of gently following your animal with a ladle that we use to get a little bit more extension into a clean ladle where we will package that urine up to evaluate. Another way that we will do it sometimes with male dogs would be to do a catheterized sample. So we will use a sterile technique to do it cleanly into the penis and into the bladder so that we can get a urine sample that way. Sometimes we'll do what's called a cystocentesis, which is basically we take a long needle and we have the animal either on their back with their belly up, or we have them on their side where we can feel their bladder or use an ultrasound to find their bladder on the ultrasound, and then we put the needle actually directly into the bladder, and that is the most sterile sample that we can get. That is really important if we think that there might be an infection and we might want to culture the sample, meaning to see if there's bacteria growing, and if so, what bacteria might, the bacteria might be responsive to which antibiotics. Sometimes we want a free catch though, and we want to get the first morning urine sample that is the most concentrated and the most likely to give us a good feel for how the kidneys are working. We might want to do a sample with we might want to do serial samples to see what the urine samples look like over time. If we're worried about the kidneys in particular, we'll often want to do that to see how they're concentrating, if they're letting any protein leak through, which is an abnormal finding that we want to make sure that we know the cause of. And then sometimes we'll want to do special tests that include something called a urine protein to creatinine ratio. Again, looking for that protein that we think shouldn't be there. Or maybe a urine cortisol to creatinine ratio, which is a screen for if there is something amiss with the adrenal glands that are kind of in charge of the cortisol system in the body. So lots of different things that we get from the urine samples. We can also sometimes see sugar spilling into the urine samples that can give us an indication that either the animal is under stress or that they are maybe tipping towards the point of diabetes. All right. And so another thing that we're going to do is kind of dissect apart the blood work. So the blood work, we're going to look for different kidney parameters to see if there's any kidney issues that may be leading to these changes in urination and typically thirst as well. There can be signs of infection. There could be signs of autoimmune disease. There could be signs of a chronic kidney insufficiency or kidneys just not working as well or pulling their weight in the body as well as they used to. We might be looking for liver issues. So this might be liver infections, gallbladder troubles, inflammation in the liver, even things like in rare cases, tumors or benign masses could lead to that. We could also see some hormone issues that we could pick up through the blood work, and so sometimes we would do specialized blood work following the blood work that we do that is more general to pick these up, but that's where we're going to start. We might look at the thyroid hormones and some indicators that might tell us about the adrenal glands. We're also going to look for blood sugar that might tip us off again to the potential cause of being diabetes. So the symptoms that you describe to us and the history that you give us, or the kind of story that you have told us about what has changed and what is different in your pet, is going to tell us a lot about how we're going to approach this to find the cause of this inappropriate urination. And then sometimes we're going to even suggest that we do some imaging. So imaging might be some radiographs or x-rays where we're looking for any kinds of abnormal anatomy, or maybe some bladder stones or some kidney stones that might show up on an x-ray. There might also be some abnormal mineralization in the urinary tract that we're going to want to know about. Maybe we're looking for changes in the size of the liver or the placement of the liver. Maybe we're looking for something fishy in the gall bladder area, all of those things. Sometimes we'll want to do an ultrasound, so where radiographs give us a three-dimensional image of what the structures of the a two-dimensional image of what the structures in the abdomen in this case look like. They give us a nice shape to things, and they give us some feedback in terms of gases and liquids and soft tissue structures. An ultrasound is going to give us a better sense of what the architecture of the organs look like. So do the kidneys look like they are normal looking kidneys on the inside, or do they look a little bit challenged or changed in some ways? Some bladder stones and kidney stones cannot be seen on an x-ray, but they can be seen on an ultrasound, so we're going to look at that. We're also going to look at things like, are the tubes that connect the kidney to the bladder, are they changed in any kind of way? Are they dilated or bigger? Are they obstructed in any way? So that's going to give us good information there as well. In male dogs, we might be looking at what the prostate looks like in both x-rays and even more detail probably on an ultrasound. An enlarged prostate can cause some urinary problems as well. And then sometimes if it is something that we are still struggling with and we think that there is something going on within the bladder or the urethra, we may even do an endoscopy to take a peek. So put a camera up there. That would require, of course, as a kindness, anesthesia. And so that is a much more kind of invasive kind of procedure, but sometimes is necessary if there's something that we can't visualize unless we are actually in the actual tube of the urethra or in the organ of the bladder. And there's more specialized imaging as well, but that is kind of the beginnings of it. So in terms of treatment, the treatment is going to vary depending on what the problem is. So it could be something as kind of gentle as corn silk to help with inflammation of the urinary tract or function of the urinary tract. Could be antibiotics if it's a urinary tract infection. It could also be something that can only be handled with surgery if it's some kind of bladder stone that cannot be dissolved with diet. Sometimes it's addressed with diet, and that is the best news. But all sorts of different issues can be we can find treatments in different ways. The other things that can help with things like kidney disease and liver disease, there's a whole lot of different herbal medicines. Acupuncture can help with that, acupuncture, laser, all sorts of good stuff that can be helpful, always depending on the diagnosis. And then if we have determined that the physical body is doing everything that it should and that there is no abnormalities there, we can then move on to attribute it to something that could be called behavioral. So this is something that is more akin to there's something psychologically happening with that animal that is causing them to communicate that they're distressed. So I really, really want my clients to know that it is not vengeful. It is not laziness. It's not a matter of training when these things start, most likely. If we have deduced that everything else is going along fine, it is the pet's best way of communicating that something is wrong. So I think that it is very common for us as humans to attribute it as like a message, and it certainly is a message to us, but it's usually a cry for help. I think that one of my best examples of this in my own life was my very first dog was suffering from like kind of an early medical condition that we didn't know about yet. And my cat came up and in front of us, my husband and I, urinated right in front of us on the dog's bed. And then later that day, my dog started showing us symptoms of what was going on with her at the time. And I thought, wow. So Churchill, my cat, was trying to tell us that there was something wrong with Bella, my dog, and what a sweet thing that was. And so I try to just mention this just to make sure that people know that they can't talk to us, so they're trying their best to tell us that there's something wrong. And once we know that there's something wrong, we can work to help fix that. And it can often be a process, especially if it's a stress for the animal that's causing it. It's really important to dive into this and figure out what's at the root of this. So it can be sometimes it's always really important for us to discuss what's going on with the household. Is there a new stress in the household? Maybe there's a new baby. Maybe someone has moved out. Maybe the physical surroundings of the house has changed, and that might be causing stress for the animal. Maybe there is a different routine that started, and that is causing trouble. Maybe there is some other stress, a new pet in the household or something that can point us to a new line of thinking. Sometimes with cats, it can be a new litter box. It can be a different litter box arrangement. It can be a new type of litter. It can be a new type of food. All sorts of things that can cause enough change that animal is really stressed out and trying to find a way to make sense of their world. So we kind of have to look at things from the perspective of the animal and see if we can find some kind of explanation. A lot of times it takes time and it doesn't occur to us overnight. And if it did, we would fix it right away, of course. But it will take time to figure out what this is. Sometimes it's something that we can easily change. Sometimes it's something that we can't easily change. And so we have to find a way for the animal to manage their stress or help them manage their stress in some way while they become adjusted to whatever change has happened or whatever change has happened, even if it's in their own mind. A lot of times it helps to have enriching activities for the animal, whether they're a cat or a dog. Maybe that dog needs a little bit more exercise to kind of soothe their brain a little bit. Maybe it's a cat that needs to eat their meals out of a puzzle or a food toy just to kind of get their brain working on something healthy instead of worrying about something else. There might be something that we can do with acupuncture or Reiki to help with kind of rebalancing the nervous system. Sometimes we need to reach for our conventional medicines, and sometimes we need to even alter things that are in the environment that we can do something about. Maybe the cat needs a break during the day from the other animals or from the toddler in the house. Maybe the dog needs to go into a timeout and have a nap time every day, just in their crate or in a room that's peaceful for them. So different things that we can try to do, and then we see how that animal responds to that, and then we make decisions from there. I'm hoping that all of this has informed you a little bit about what could be going on in an animal that's inappropriately urinating. And I think that it's also hopefully helping you to see why it's really important to have a conversation with your veterinarian and your veterinary team about all of these things that could go into it, and to kind of be patient with us as we kind of wade through, okay, it's not a urinary tract infection, kidney function looks fine, and then we get to whatever the root of the problem is. Hopefully it's something easy to fix. Hopefully it's something that we can do lots about, but if it's not, we're here to help you find how to manage it going forward. If you have any questions, I'm on a phone taping this, so I can't actually see any of the questions right now. But if you have any questions, then please write them in the comment section and we'll get back to you with some answers to your questions as best as we can. If you have any requests for topics that you'd like us to cover for our Sleepy Dog Facebook Lives, let us know. Our next Sleepy Dog Facebook Live will be Nurse Sam giving us a demonstration of her newly acquired craniosacral skills, so that we can see how it looks like on a real live animal and how well tolerated it is. And that will be in another month, and we'll put it on the calendar soon. Okay, thanks. I hope everybody is enjoying the sun. It's certainly sunny and spring-like here in Massachusetts. And as we go through and all feel a little bit more hopeful about COVID-19, hopefully getting better and better in this world. Okay, thanks. Bye-bye.